Dr. Winters here, and I want to talk with you about the biggest breakthrough in our work in 2023. And the biggest breakthrough in our work is understanding that our nervous systems are different post-pandemic than they were prior to the pandemic. Because people have had such a load of stress that the autonomic nervous system is behaving differently. And of course, we see more people with non-medical cardiac symptoms, that they have these cardiac symptoms, they go get checked out with the physician and everything's fine. That's due to the autonomic nervous system that controls our blood vessels, organs, and glands without us thinking about it. Then we have much more anxiety because we don't feel safe in our bodies. And the biggest understanding that we've had in the last few months is through the lens of the polyvagal theory, which is a theory to explain human behavior based on the autonomic nervous system. We've always known about fight or flight, and we've known about the parasympathetic nervous system, but we didn't really realize that we have two branches to that vagus nerve, one that's more up here in the chest and one that's more down here below the diaphragm. And as we've been working with that, we see that when we're regulated here, we feel calm, connected, at ease, socially engaging. When we're fight or flight, of course, we're ready to fight or we're ready to run. And then if that fails, we go into more of a shutdown mode, which this lower part of the vagus nerve called the dorsal vagal, more coming from behind, that part is more active. And then we have more shutdown, we have more immobilization, we have more fatigue, laying in bed, can't get up, can't get enthusiastic, or we have people fainting and collapsing and things like that. You may or may not be able to see this visual really good. You see the green is the ventral vagus, the front part here. The red is the dorsal vagus, what's down here in the gut. So looking at this picture, you can now see why we do so much work in the diaphragm, which is the bridge between those two parts of the vagus nerve. And we do so much work in the viscera around the bladder and the stomach and all those internal organs. It makes such a difference in helping people feel calm and connected and at ease. And then we, of course, adjust the spine as well and adjust for brain balance. But this understanding of the autonomic nervous system and how we're behaving differently post-pandemic has been crazy good for us, because I was seeing in the techniques that I used prior to the pandemic, which were amazing, even in our QNRT, especially our autoimmune QNRT, that I wasn't getting the same responses, or I wasn't getting the same clarity out of the nervous system after the pandemic occurred than I was before. And I found the difference in this explained by the polyvagal theory and working with this vagus nerve differently. And so that's been our biggest breakthrough through 2023. It's helping people feel more calm, more at ease, more like they have things together, and it's making for much happier patients yet. And if you're not getting that kind of care you need to, I know we're extremely busy, but you need to get on our waiting list and get in our office. It'll change your life. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.